DV verdict. Title: The hospital that sued 400 people in one town. Formula: exposed, duration 11 min. Tags: hospital lawsuits, medical debt, rural healthcare, patient suing. A rural county in Kansas. Population: roughly 9,000 people. In a single year, one hospital in that county sued more than 400 of its own patients for unpaid medical bills. 400 lawsuits. In a county of 9,000. That means roughly 1 out of every 22 residents was dragged into court by the institution that was supposed to heal them. These weren't wealthy patients dodging bills. These were farmers, shop clerks, home health aides, and retirees. People who had walked through the hospital's doors in their worst moments and were now being served legal papers for the privilege. This is the story of how a rural hospital turned its emergency room into a debt factory, and how an investigation revealed it was happening all across America. Medical debt is the #1 cause of bankruptcy in the United States. A 2023 study published in JAMA, the Journal of the American Medical Association, found that approximately 100 million Americans carry medical debt. Nearly 1 in 4 adults with healthcare debt owe more than $5,000. For uninsured patients, a single emergency room visit can generate a bill between $1,500 and $30,000, depending on the treatment required. Unlike virtually every other developed nation, the United States does not guarantee universal healthcare coverage. As of 2024, approximately 27 million Americans had no health insurance at all. Tens of millions more were underinsured, meaning their insurance carried deductibles and copays so high that a major medical event could still bankrupt them. Here's the part most people don't know. Nonprofit hospitals receive enormous tax benefits, exempt from federal income tax, state income tax, property tax, and sales tax. In exchange, they're expected to provide charity care for patients who cannot pay. The IRS requires nonprofit hospitals to have a written financial assistance policy, publicize it, and make reasonable efforts to determine if a patient qualifies before pursuing extraordinary collection actions, lawsuits, wage garnishment, property liens. The expectation is clear. Nonprofit hospitals should not be suing their poorest patients. That expectation and reality are very different things. In 2019 and 2020, a major national news investigation exposed the scale of hospital lawsuits against patients. Reporters spent months analyzing court records in dozens of jurisdictions. A rural hospital in Kansas became one of the most striking examples. According to court records, the nonprofit hospital had filed hundreds of lawsuits in the county's district court. In a community where everyone knows everyone, the institution was using the court system as a collection mechanism with factory-like efficiency. The lawsuits followed a pattern. A patient received care. A bill was generated. The patient, often uninsured or underinsured, couldn't pay. After some period of collection attempts, the hospital's legal team filed suit. Many of the defendants were low income. Some were elderly. Some were disabled. According to the investigation, many would have qualified for the hospital's financial assistance program if they had known it existed or had been helped through the application process. The reporting found that hospitals across the country routinely failed to screen patients for financial assistance eligibility before suing them. They buried their charity care policies in fine print. They didn't train front desk staff to inform patients about assistance options. They treated financial assistance as a last resort rather than a first step. According to court records, the investigation found that some hospitals were suing patients for amounts as small as a few $100s. The cost of litigation, filing fees, attorney time, court appearances, often approached or exceeded the debt itself. But the hospitals weren't just trying to recover the specific amount owed. They were trying to obtain judgments that would allow them to garnish wages and place liens on homes. A $1,200 hospital bill, once converted into a court judgment, becomes a tool that can follow a person for years. In that Kansas county, the impact was devastating. Wage garnishments meant workers took home less money. Credit damage meant families couldn't qualify for car loans or apartment leases. The stress of being sued by the hospital that delivered your children, that treated your parents, that you'd relied on your entire life, corroded trust in the institution at the core of the community. The investigation revealed a nationwide pattern. According to court records, one major university hospital system in Virginia had filed more than 36,000 lawsuits against patients over 6 years, over $106 million in court judgments, garnished wages, liens on homes, all while sitting on an endowment worth billions. After the investigation's findings became public, that hospital system announced sweeping changes. It eliminated lawsuits against patients earning less than 400% of the federal poverty level. It wrote off $73 million in patient debt. According to research published by a major university, nonprofit hospitals in some states were suing patients at rates comparable to, and sometimes exceeding, for-profit hospitals. The tax exemptions that were supposed to incentivize charity care were not, in many cases, translating into actual charity. According to federal regulators, medical debt appeared on the credit reports of 43 million Americans, approximately $88 billion. The three major credit bureaus announced they would remove paid medical debts and eliminate unpaid debts under $500. The change, fully effective in 2023, removed an estimated 70% of medical debt from credit reports. But removing debt from a credit report doesn't eliminate the debt. The lawsuits continued. The garnishments continued. States began acting on their own. Colorado in 2022 prohibited